Thank you to Scottish Sentencing Council for inviting me to speak here today. We're going to be on a bit of a whistle-stop tour, and I'm going to echo Lord Calloway and Professor Thompson's comments on many of you may know as much as I do about some of these topics, and apologies in advance for that. Jana and I are going to spend the next 30 minutes telling you about some of the neurodevelopmental conditions that you'll see most often in criminal justice settings. The term neurodiverse describes us all, whether we consider ourselves to be neurotypical or whether we might consider ourselves to have one of the conditions listed here. It's a term used when, so we're going to focus on neurodevelopmental disorders, so a very specific kind of type of neurodivergence where cognitive difficulties have resulted in functional impairments such that somebody's functioning is significantly outside the range that would be achieved by most of the population. Typically, cognitive impairment is defined as functioning below the second percentile. That is to say, if you took 100 members of the general public, it would be the 2 individuals within that group who were experiencing most difficulty. I'm going to focus on traumatic brain injury, developmental language disorder, attention deficit hyperactivity disorder, and fetal alcohol spectrum disorder. So everything's going to be very brief, and bear with me on that. One point to bear in mind while we do is that all of these conditions will overlap to some extent. The symptoms aren't discrete, and comorbidity is the norm rather than the exception. So according to the National Autism Implementation Team, NATE, as many as 15% of the Scottish general population may have a neurodevelopmental condition. And I think it's important to acknowledge there that actually it's apparent that most of those won't actually have a diagnosis. So by the time you see somebody in criminal justice, they won't come with a diagnosis. You can't assume that that's happened in child services. Sadly, we know that neurodevelopmental difficulties of all types are more common in those who find themselves in contact with the criminal justice system. And here you can see listed some of the more common conditions and their estimated prevalence both in the wider population contrasted with prison populations. And I had a wee moment there while Adam was presenting his, because our figures do vary slightly, but I can see that he was talking about more local data. I've gone for worldwide data because actually there's very little data on neurodevelopmental disorders in the UK, and that's because actually we're still kind of playing catch up with some of those in terms of our diagnoses in child services. Most common, you can see, is developmental language disorder, closely followed by TBI and FASD, with all 3 potentially affecting half of studied populations. It's important to remember, however, that while some of these conditions are overrepresented in criminal justice, these numbers still only represent a small minority of those affected by those conditions, the majority of whom will never have any contact with criminal justice. So, the first of our conditions, developmental language disorder is a communication disorder that interferes with learning, understanding, and using language. So it will affect a child's speaking, listening, reading, and writing, and often becomes more apparent as they start school. Symptoms in older children and adults tend to be word-finding difficulties, grammatical and spelling difficulties, kind of limited use of complex sentences, and difficulty understanding figurative language. Poor reading skills, and disorganized narratives and writing. Without early recognition, these difficulties could be misinterpreted as behavioral issues. For instance, if somebody is struggling to communicate, they may become frustrated and act out. Indeed, a Lancashire study with young offenders identified that 60% actually met criteria for DLD, which had been previously undiagnosed. And they followed them up for a year, and those with DLD were twice as likely as their peers to reoffend within that 1-year follow-up period. And DLD was a better predictor of reoffending during that 1-year period than non-verbal IQ, social deprivation, number of past offences, and the age at first offence, all predictors that we would imagine would be quite strong. Moving on to ADHD, with which you might be more familiar. As you might imagine, ADHD is characterised by a persistent pattern of inattention and/or, not necessarily and, hyperactivity, impulsivity that interferes with functioning or development. It's estimated to affect 5% of children, and 90% of those will still meet diagnostic criteria as adults. Difficulties can present more of an issue with attention regulation rather than deficit. That would be to simplify it. They might have trouble sustaining attention, but actually it might be hard to gain their attention if they have found a task absorbing. Identifying what is and is not appropriate to focus on can be a challenge, and it can be difficult to redirect somebody's attention if you are to interrupt them. Tasks may remain unfinished, their focus wander, and they can appear ill-organised, ill-prepared and forgetful. Those affected are often described as being constantly on the go, unable to remain seated for long, and they may appear restless or difficult to keep up with. Impulsive individuals may have difficulty with turn-taking in conversation, perhaps blurting out an answer early or finishing your sentence for you. And waiting or queuing can be a challenge. Personal boundaries or possessions may be encroached on. Importantly, poor risk assessment and risk-taking behaviours are common, particularly pertinent to our population. A 2020 review of people with ADHD who'd committed offences identified that they became involved with criminal justice at an earlier stage, had a higher risk of recidivism, and were more likely to make false confessions. Fetal alcohol spectrum disorder, or FASD, is one potential consequence of alcohol exposure during pregnancy, and not all exposed pregnancies will be affected. FASD is conservatively estimated to affect 1 in 20 of the UK population. However, I say conservatively because that figure is taken lock, stock and barrel from Canadian figures, and the Canadians have had a no alcohol, no risk during pregnancy message to pregnant women for some decades, I think 3 decades, prior to that being introduced in Scotland. FASD is an umbrella term that refers to a spectrum of lifelong physical and cognitive impairments that can be a consequence of alcohol exposure. And that exposure can lead to differences in the structure, size, growth and function of the brain and central nervous system, which can in turn result in impairment in any cognitive functioning depending on the timing and the dose of exposure to alcohol. As a result, there's no typical profile of an individual with FASD. There will always be a range of strengths and difficulties, and a patchy profile is common. The infographic on the right indicates the abilities that we need to diagnose if we are to assess FASD, with significant difficulties in at least 3 domains required for a diagnosis, amongst other things. Only 1 in 10 of those affected will display the facial features that are associated with the subtype of FASD called fetal alcohol syndrome, which many of you might be more familiar with. But as a result of that, FASD may only become apparent as a child matures and has difficulty achieving age-appropriate skills. At least 1 in 5 individuals in criminal justice is estimated to be affected. And contributors to this will include their being particularly easily led by others, their inability to learn from experience, and their being highly suggestible. Traumatic brain injury, or TBI, is the result of sudden trauma. It can result from blows to the head, rapid acceleration or deceleration, or a penetrating injury. Symptoms can range from minor and short-term to debilitating and permanent. TBI in children and young people can affect both their current and their future development, and is actually the leading cause of death and disability in under 18s in the UK. In contrast to previously held beliefs, childhood TBI is not repaired by the developing brain. Rather, it can result in neurodegeneration and volume loss, such that it would disrupt normal childhood development, and the results can be both widespread and permanent. But some years after the fact, people aren't thinking about a child's head injury that they appear to recover from, so there's little recognised. Although any aspect of brain function can be affected, cognitive impairments, sensory processing, communication, and behavioural and mental health difficulties are common. Importantly, a head injury does not need to be severe to result in lifelong impairment. Although the symptoms of TBI are largely dependent on severity, concussion, or mild TBI as we would call it, can lead to short and even lifelong cognitive and behavioural problems, particularly if that's repetitive injuries, that there's more than one. A 2018 review in The Lancet identified that TBI is a risk factor for earlier, more violent offending, is linked to earlier reconviction, poor engagement in treatment, and increased custodial infractions. Given neurodevelopmental conditions and often the effects of TBI are lifelong, adolescents and adults are at risk of secondary harms. Here we present the prevalence of the conditions we've discussed in 4 vulnerable populations. Evidence suggests that having unrecognised neurodevelopmental difficulties, and unrecognised is the important bit there, increases the likelihood of becoming a member of one of these groups. We know, for example, that affected children are more likely to be the victim of physical abuse and to be care experienced. We also know that in the absence of a diagnosis which allows both them and those around them to understand their challenges as being brain-based, many will find themselves medicating or experiencing mental illness. Obvious to you all, I'm sure, is the significant overlap between all of these populations, likely arising from their shared vulnerabilities, which we would suggest includes neurodevelopmental disorders. So, what are the cognitive vulnerabilities that increase the likelihood of contact with criminal justice? Here you can see the results of recent meta-analysis identifying the cognitive impairments that are overrepresented in offender populations in comparison to the general public. I've incorporated them into a Venn diagram to illustrate the vulnerabilities shared by those with the diagnoses I'm describing today. And you can see that attention and other executive functions, including social cognition, are more an issue for a criminal justice population. Importantly, you can see that those with TBI and FASD may experience all of the known risk factors. And I also want to draw your attention to the fact that language, where actually we saw the largest effect sizes, that is to say that language differentiated offenders from non-offenders more than any other domain measured. Likewise, you can see here the results of a meta-analytic review examining the difference between those who have been convicted of a violent offence versus those who've been convicted of a non-violent offence. And again, language here listed as expressive speech is of particular relevance, with an effect size more than twice that of any of the other domains listed. So how do these cognitive difficulties actually increase the likelihood of somebody coming into contact with the criminal justice system? Here along the top, you can see that I've listed some of the cognitive factors that might act as predisposing or destabilising factors, or which might undermine efforts to desist from offending. Below each, you can see some examples of how those difficulties might either directly increase somebody's risk of finding themselves in trouble or increase the likelihood of a known risk factor such as unemployment. These are, of course, all interrelated and simply a snapshot of the many implications of cognitive impairments. And I'm going to start speeding up now because I've just had my 2-minute warning. Thank you. Of course, these difficulties don't just influence whether you come into contact with criminal justice, but also how you interact with the system. Here, I've again highlighted some key cognitive difficulties, and this time I've included some examples of how they might impact on whether somebody can give an accurate account of events, take legal advice, and follow court proceedings. Individuals with intellectual disability, and FASD in particular, are known to be suggestible and at increased risk of false confessions. Despite the presumption against short sentences in Scotland, custodial sentences of less than 12 months still made up 75% of custodial sentences handed down in 2021. And in 2023, the reconviction rate for those with a sentence of 3 months or less was 61%, and 53% for those with a sentence of 3 to 6 months. We believe that neurodevelopmental conditions are likely to be particularly prevalent among the repeat offenders who can't learn from their mistakes and keep repeating the same patterns of offending, those committing less serious offences where the offences appear spontaneous, involve poor judgment or misunderstandings, and offenders breaching their conditions where they may have difficulties understanding or remembering those conditions and organising themselves to attend appointments, etc. Contributing to these high reconviction rates may be the challenging nature of the trial process for those affected. They may find it hard to give a coherent account of events or explain their actions, potentially making them appear uncooperative or as if they have something to hide. They may not understand their rights or the motivations of others caught up in events, and during trials they may have difficulty understanding the guidance of their brief and conveying their preferences. The trial itself, of course, requires the ability to keep track of details from multiple perspectives and to link information and consider consequences. There is perhaps a solution. Canada has led the way in the introduction of specialist therapeutic courts, and one of these is specifically for those with FASD, but the model could easily be extended to encompass other conditions. The FASD court hears cases from breaches to more serious matters, has a range of diversionary sentences available to them, and importantly, all members are knowledgeable about the condition. Offenders with an FASD diagnosis who wish to plead guilty are brought before judges who consider how their condition may have contributed or indeed not contributed to the offence they committed. Justice workers prepare an assessment in advance that talks about their strengths and challenges and includes a plan of action. The process is informal, slowed down, and distractions are minimised. It's reputedly in very high demand. So in conclusion, excuse me, neurodevelopmental disorders and TBI are significantly overrepresented in criminal justice and can increase both the ability propensity to offend and decrease the ability to desist from offending. And I would argue that such difficulties should be identified and their influence considered. An assessment, a risk assessment, should also make some consideration of the possibility that a neurodevelopmental condition exists but is yet to be recognised. Thank you.